And at the end, I'm going to help with reading some of the questions. So what you do is in your panel or dashboard, you can type your questions throughout the presentation, and then I can, and B may help too with reading them out loud and trying to answer some of your questions. The recording of this webinar will also be posted on the DFSS YouTube channel. So if you look up Department of Family and Support Services YouTube channel, you'll be able to find this recording. Should be posted in the coming days or right after Memorial Day weekend. Thank you, and I'll turn it back to B.
Thank you, Tom. Again, this is B. Nichols, Director of Children's Services. Tom, if you could go to slide number 3. So what you see here is the Department of Family and Support Services and our differing program divisions. Created in 2009, DFSS provides a comprehensive, client-oriented human service delivery system that employs a holistic approach to improving the quality of life for our most vulnerable residents. DFSS supports services that enhances the lives of Chicago residents, particularly those most in need from birth through their senior years. We provide families with the resources they need to not only create a strong developmental and educational foundation for the young, but across the lifespan by coordinating services for vulnerable youth, adults, and elders through our various program divisions. Next slide. In 2016, DFSS launched a strategic framework with a mission dedicated to community, its residents, and families that seeks to improve the lives of all Chicagoans. Next slide. DFSS has contracted with community-based agencies to carry out direct, high-quality services to enroll children and families, and we're guided by these 3 priorities: maximizing access, reducing barriers to access, matching investments to community needs, improving the comprehensiveness and quality of our programs in order to meet children's needs, creating a system of supports, and reducing the administrative burden for our providers. Next slide. We serve vulnerable families in low-income communities and provide high-quality, developmental appropriate services. These services wrap around the child and the family. In order to do this, we ensure a child's health and physical needs are met. We engage the parents and understand that in order to support them, we must recognize that they belong to families who live in communities. Chicago early learning sites are in those communities and funded by DFSS to operate programs like the Federal Head Start program and the state-funded Preschool for All and Prevention Initiative programs. And now, Nicole Craft will be describing the scope of the Mental Health Services Support RFP. Nicole.
The Family and Support Services administers Chicago early learning programs through a network of contracted direct service and support service delegate agencies. Currently, the department contracts with a network of 100 direct service agencies across 351 sites. These programs may be delivered through center-based, licensed family child care homes, and home-based home visiting models, and may operate full or part year. Next slide, please. The Department of Family and Support Services Children's Services Division seeks an entity that can provide subject matter expertise and training and technical assistance to the department and its Chicago Early Learning direct service providers in subjects related to mental health services. As a result of these activities, the Department of Family and Support Services and its direct service agencies should maintain mental health services compliance with Chicago Early Learning Standards 2.0, the Illinois Early Learning Illinois Early Learning Developmental Standards, Illinois Early Learning Guidelines, Head Start Early Learning Outcomes Framework, Head Start Parent, Family, and Community Engagement Framework, Head Start Program Performance Standards, and the Head Start Act. DFSS and its delegate service agencies will integrate a trauma-informed approach into their mental health services and will have policies, procedures, and strategies for maintaining and improving staff mental health and wellness. Next slide, please. DFSS intends to contract with one entity to provide services to the agencies citywide that can meet the following qualifications. Successful respondent shall have a credentialed mental health consultant either on staff or under contract and will be considered as the lead mental health consultant. The agency's consultant must meet the following credentials. Next slide, please. All mental health consultants must be licensed or certified mental health professionals with knowledge of experience in serving young children and their families. Mental health license or certification can either be a doctor of psychology, licensed clinical professional counselor, or a licensed clinical social worker. The mental health consultant will be considered the primary consultant to DFSS and will co-chair the Health Services Advisory Committee and its Mental Health Subcommittee. Next slide, please. The contractor shall demonstrate the staffing capacity and meet the required credentials to conduct the services and activities required of this contract, including having on staff or under contract 10 to 15 full-time employees who are mental health professionals. They must demonstrate expertise in children, family, and adult mental health and early social-emotional development, including infant-toddler mental health and trauma-informed care. The contractor should demonstrate a working knowledge of one or more of the following and demonstrate the capacity to acquire expertise in all of the following. Mental health requirements for children ages birth to 5 who are enrolled in the Chicago Early Learning programs, including the Head Start Program Performance Standards, the Chicago Early Learning Standards 2.0, the Illinois Early Learning Developmental Standards, the Illinois Early Learning Guidelines, and the Illinois Department of Family and Support, DCFS licensing standards. The contractor shall demonstrate the ability to interpret and explain mental health policies and research that affects children ages birth to 5 for a lay audience. They should demonstrate experience providing training and technical assistance to adult learners on topics related to mental health and trauma-informed care. Next slide, please. For a full understanding of the Chicago Early Learning Program standards as it relates to mental health, we've included a list of resources with this presentation, and we will make this available to you at a later date. Next slide, please. The following activities will be required of the mental health provider. The contractor should provide guidance on subject-related policies and procedure development, and policy memorandum related to best practices, subject area research, and program requirements and standards. They should consult with the Department of Family and Support Services to provide clarity on program components, service expectations, program requirements, and standards. They shall advise the departments and its direct service agencies on current and new mental health issues and trauma-informed care practices. And they act as the co-chair of the quarterly health services advisory. The contractor shall also support the department and its direct service delegate agencies in forming community partnerships with local providers of mental health services and trauma-informed care, so that these agencies can refer children and families for services as needed. And Tom, I apologize, I'm on slide 14.
Yes, I'm on that slide too.
They shall provide ongoing regular training and workshops for direct service delegate agency staff regarding the program requirements, best practices, and other subjects related to mental health services and trauma-informed care. The contractor shall provide intensive training and technical assistance in which the support service provider will work with the Children's Services Division staff to develop training plans, corrective or quality improvement plans, and tailored training programs for direct service delegate agencies to address deficiencies and noncompliances in mental health services policies and procedures required by the federal and state guidelines which govern the program. They shall also set up or improve internal systems for meeting mental health related standards, for addressing innovative practices or addressing mental health issues that are prevalent in the community. Next slide, please. The contractor shall conduct observations of direct service delegate agencies, sites, and classrooms. DFSS anticipates 200 observations quarterly, each taking 4 to 8 hours. The contractor will also support parent education in mental health by developing and providing direct service delegate agencies sample materials for parent bulletin boards and handouts that can be reproduced by the delegate agency, as well as training tips for parent orientation, parent education classes, and parent councils and committees. They shall conduct 3 4-hour sessions at the annual Chicago Early Learning Parent Conference, and they will conduct at least 10 hours of parent trainings in mental health and trauma-informed care related subjects at the parent hubs. Next slide, please. To determine the impact of the aforementioned service activities, performance outcomes may be assessed in the following manners. 1, after receiving intensive training and technical assistance from the support service provider, the delegate agency will demonstrate compliance with the Head Start program performance standards, the and the Chicago Early Learning Standards 2.0. The support service provider will administer pre- and post-training surveys that assess the impact of training on the attendees' knowledge, and the Chicago Early Learning programs will demonstrate improved integration of trauma-informed practices. Next slide, please. Performance indicators. DFSS also intends to track output metrics that may include, but are not limited to, the number of annual trainings, the number of intensive training and improvement action plans, the number of community partnership collaborations supported, the number of hours provided to the Health Services Advisory Committee and subcommittees, the number of hours and type of subject matter expertise and consultation provided to the Department of Family and Support Services, including, but not limited to, policies and procedures drafted and distributed to internal and external stakeholders. Lastly, the number of observations, technical assistance, and support provided to individual delegate agencies. In addition to these performance indicators and output metrics, DFSS encourages, including those that demonstrate early success and are indicative of participants' progress. This concludes our overview of performance measures, and now I'll turn it back over to B.
Thank you, Nicole. And now we're going to look at the selection criteria of a proposed program. Applicants will be asked to respond to questions related to the required core elements, which are identified in the program description of the RFP. An effective program model for the right target population and the desired results. In this section, we will ask you to describe your approach to education, training, mental health issues, trends, and innovative strategies that you've employed. We will ask about your agency's approach to providing intensive training and technical assistance to organizations that are failing to meet program standards. Next slide. In this section, we will ask about program performance, outcomes, and quality. How the agency has performed in the past, and if the agency is committed to performance management and measuring outcomes over the last 12 months. If relevant, you will have an opportunity to upload any report based documentation that of your program. You'll want to describe your agency's current and past relationships with community health partners, mental health partners. You may want to describe a collaboration that resulted in improved mental health outcomes or access to mental health or trauma-informed care for children, families, and staff. You may want to describe how at least one partnership resulted in better outcomes for the child, parents, staff, or community health. Refer to your performance reports or other documents that you've uploaded to further demonstrate your point. Next slide. This section talks about organizational capacity. So we'll ask you to describe relevant staff positions and qualifications. What is your monitoring of program expenditures and ensuring appropriate fiscal controls are in place? Policies and procedures, including hiring practices and the ability to fill essential positions in a timely manner. Next slide. Reasonable costs, budget justification, and leverage of funds. What is your agency's financial capacity to operate the program? Cash flow and capacity to matching funds. Program costs considered to be reasonable given the nature of services provided and requirements for this program. Next slide. The deadline for submission of this application proposals must be submitted via online application, and you have to be registered in our system to submit. We will not accept any email or fax proposals. And now I'll turn it over to my colleague, Julia.
Hi, this is Julia Talbot. I'm here to talk to you about how to actually do the physical application process in the eProcurement environment, which is how the city does their procurement and how we submit our applications. After that, after I'm finished talking and going through a few basic concepts and showing you some screens on how to do how to submit, how to accept an application, we'll take questions about, if you have questions about any of this. So now you know. Okay, going to the next slide. We can start the presentation. So the eProcurement environment is, you'll need to register, as to be indicated. If you haven't done business with the city before, you'll need to register into eProcurement. That I have some links on the next couple of slides about how to do that. You should budget anywhere from an hour to 3 or 4 days to get a response. So you fill out some questions, you set up an account, and you then send it off to the Department of Procurement that's outside of DFSS, and they approve your registration and set you up with an account. So that setting up an account and getting an email back from the city's procurement department takes anywhere between a few hours at the quick day to more likely a day or 3 or 4. Sometimes they say 7, but most times it seems like it takes 3 or 4 days. So that would mean, working backwards, you really need to start your application process if you don't already have that set up. So you need to register. The second thing we really like to do is I really encourage people to read the RFP document that we have attached into the application and into the information that we load into eProcurement. The RFP has a scope criteria that we list in the RFP, and then the application questions and the evaluation instrument that we develop to score your application questions fall out of a combination of the scope and the evaluation and selection criteria. So just pay attention to this alignment. If you find yourself looking at our application questions and not necessarily knowing what direction to head in, refer back to that scope document. It was written to describe what we wanted, what we're looking for, and let that guide you and help you inform your decision making about if this is a good fit for you, but also inform your decision making, about how to answer a question or how to plan for the work that we're looking for the support service contractor to do. So I would do that. I also would, it's really prudent to review the selection criteria and the RFP quite carefully. And then when you're ready to write an answer, remember that there's a 4,000 character limit, which includes punctuation and spaces for each question that we ask. You'll go into the eProcurement environment. The application questions are in the requirements section, and each requirement section, each question is referred to as an individual requirement, and each one of those questions has 4,000 characters for the answer, unless it's a yes and no answer. The eProcurement system works best. It was built off of an Oracle platform, and it works best on Internet Explorer. I have also used it successfully in Chrome, Firefox, and Safari, but it was built on Internet Explorer. If your computer is having a hard time, you're getting kicked out a lot, the first piece of advice I would give you would be to run it in Internet Explorer and see if that doesn't help your problems. This is a system that it has not crashed in the 3 years that I've been using it, but that doesn't mean that your computer will get along with it. It times out occasionally. I trained to save early, to save frequently, save your work frequently. And on that note, the one here, like my pro tip, is to don't use your back browser button when you're working in eProcurement. If you do so, the system will keep pretending that it's working, but when you go to save, it will have not saved past using that back browser button, which means you could lose work, and who wants to do that? So let's go to the next slide. So more things that I like to really talk about is in terms of working in eProcurement, you can submit your application up into the deadline, which is June 23rd at 12. That is a hard deadline. We cannot accept late applications, and in fact, the system really doesn't allow us to accept late applications unless we reopen the RFP and make everybody else who got their application in on time to reapply. We do not accept email applications. We do not accept faxed applications. We can only accept an application in eProcurement. And so please, 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 if you have the intention, you would like to be, considered for a contract for this work, please make your application on time. Every time we have an RFP with, more than 7 people applying, there is somebody who misses the deadline because they did not take into account, the time it will take to do things. I really encourage people to understand that when you hit submit, and we'll go through this a little bit later, you're really going to go through probably 3 or 4 or 5 different slides before that submission process happens. So give yourself time. Give yourself, 15 to 30 minutes if you're seasoned on this and you think that you know exactly how to manipulate and work in this environment. If you're a newbie, try to submit the day before, just so that you have time to resolve your issues, to call me or the people at OBM and get technical assistance if you need it. Because we really can't accept a late application, and we really love to have people apply for our opportunities, obviously. The other thing I would suggest is you should make use of the eProcurement hotline for help, and our number is 312-744-HELP. There's also an email address, which will be on the next slide. You can call me, you can email me. The eProcurement hotline operates from Monday through Friday, 9 to 5. They will get back to you within 2 business days for sure. I try to turn stuff around in 1 business day. You can call me, right now we're all working from home. My cell phone, my work number is set up to my cell phone. You can really call me anytime. Chances are I will answer the phone, and I will try and help you regardless of what time or day it is. And so just, get started, work out your problems, and give yourself plenty of time. Give yourself time to submit, give yourself time to have your questions answered. Bea and Nicole are also there for all those tough program questions, but like everybody else, they work 9 to 5, and that we also are all doing multiple, managing multiple RFPs and our other job duties. And so sometimes it will take us a little bit to get back to you with a question. And so it's important that you start this process early so that you can do a great application and you have all the support that we can give you. And those, but you have to plan for things like people being in a meeting and not being able to call you back or not being there right away. So let's go to the next slide. In the case that you actually can't get a hold of somebody right away, there are some email addresses and some training materials that are online that might help you if you're having a specific problem with eProcurement. So here, if you have questions on registration, call customer support at customer support at cityofchicago.org. If you need procurement technical assistance, the same address, or call that 74HELP. eProcurement system has a lot of training documents and videos that you can watch that will walk you through some of the more basic practices that we're looking for. And you can always watch those. I have a lot of PowerPoints, and I send them out frequently. And so I think some of them went out with the invitation. Now about how to accept an amendment. All of our RFPs, if only to up the questions that we receive about the RFP. So at the end of, as I mentioned, at the end of this presentation, we're going to take questions from you. All of the questions that you type into the question box are going to be recorded. We're going to answer them, and then we're going to make them into a frequently asked questions document that becomes an amended part of the RFP so that everybody applying can read that question, frequently asked questions. So the chances of this RFP RFP is high. Now, this is how, and this is what when you go in to eProcurement and there's been an amendment, you have to accept, you have to acknowledge and accept the amendment in order to really either return back to the application that you have started or start the application anew. So let's say, you're going in for the first time, you haven't started the application yet. In order to start your application, you have to accept the amendment, and you're going to this RFP has been amended, and you're going to need to accept it. And then when you want to start your application, you go to the create, take you to your application page, will get you started. Next slide, please. So I think we're ready for the next slide, Tom.
Julia, this is Tom. I'm on this slide to begin access. You got a 1, 2, and 3.
For some
slide
reason,
28.
Yeah, it doesn't say that on my screen. Interesting. Okay, well, time, love, and the time.
You just went over the slide about view amendment history and create a quote.
Yeah.
And then the next one is to begin the acknowledgement process. Okay.
It's shown. Okay, so to begin the acceptance acknowledgement by clicking on the blue, when you're working in eProcurement, just as a heads up, anything in blue, highlighted in blue, could take you to something else. Whether or not you want to go there is another thing, but it will take you somewhere else. So to begin the acceptance and acknowledgement process, you can open the RFP document by clicking on the document number. You can review the changes in the RFP, specifically written out changes, by clicking on the little eyeglass icon that's labeled number 2. And after you've reviewed those changes and referred back to the RFP document if you want, you're going to acknowledge the amendment by clicking on the Acknowledge Amendment button on the lower part of the right-hand side of the screen. By acknowledging them, you're indicating you are aware of changes that were made to the RFP and the amendment. And we're now going to walk through about 3 more slides where really the city wants the information. We're doing this for frequently asked questions, but if you were doing it for a date change or a change to the scope or any other issue, substantial issue, we want to make sure that you understand what has been changed and change your application or yours as necessary so that you make a great application for the services that we're looking for. Then you're going to see that this another screen where you're going to acknowledge the amendment. So that is going to be finding it. So you're going to first accept this A box at the top of the screen that says, I accept, and then you're going to check that box, and then you're going to hit on the right-hand side, the box that says that you acknowledge your acceptance of the amendment. And then we're going to go to the next slide, where you are then going to confirm your acknowledgement of the amendment. So that is basically, you attest that you confirm, you say, yes, I have acknowledged this, I acknowledge that I have read it, I really acknowledge it, super no, I understand. And then you're going to hit the yes on the lower right hand side, which will take you to the next screen where you click the terms and conditions and accept them. So you're going to first click the tiny box at the bottom of the left-hand side saying that you have read and accept the terms and conditions of the amendment. And then you are going to click either on the upper right or lower right-hand side that you accept it, because there's nothing like you really acknowledging accepting that you understand the amendment. It's kind of clear at this point that the city is very interested in making sure that you have read the amendment, and we are too, as part of the city. So that concludes what I have to say about accepting an amendment. We're now going to go take some time to plan about your submission, and don't think it's going to be a last minute thing. So that's going to be the next slide after that is kind of where we get going. So when you are ready to submit your application, you're going to save your draft one last time, which you're going to do by hitting the upper, the save draft function. Message is going to be shown on the upper right hand side. So make sure you see the submittal confirmation screen, and that will be confirmation that you have submitted. So if you want verification, you're just not sure, give me a call or shoot me an email, and I'm more than happy to discuss, to confirm that you have submitted your application. And we can all go on. And that is basically, what you can see though is that when you press submit in eProcurement, it's not just like whoosh, it's gone. It's like, no, all right, now I'm going to have to wade through 6 more screens. And so please just give yourself enough time. I hate it when people miss the application deadline. I'm sure they hate it too. But I know that our applications are substantial. They require a certain amount of work and thought, and to have it bounced out of the pool on a sort of what amounts to a technicality is a terrible feeling for us all. At this point, I'm done with my end of the presentation. I'm going to turn it back over to B. This is at the time when you can start, we can start taking questions if people have questions about any aspect of this presentation. And other than that, into Friday.
Hello, B, you're on.
Thank you, Julia. Go ahead, Tom. Do we have questions?
Yes, there was one question that came in earlier. Let me pull it up here. It says, must the 10 to 15 FTE professionals be licensed, like LCSW, LCPC, or can master's level professionals serve under a licensed lead consultant?
Oh, good question. The answer to the question any needed staff. A master's level person would be working under the lead person. So hopefully that answers your question. And as Julia mentioned earlier.
And another question before, let's see, can you clarify this?
Budgets to hire their own mental health professionals. However, DFSS being is in a really good position to be able to be flexible and provide those mental health services through our contracted vendor for any of our agencies that don't have that capacity. We have, as Nicole mentioned earlier, over 100 agencies with about 351 sites. So depending on the amount of monitoring that we do, the data that we're collecting, we would work with our vendor to be able to respond to our agency's needs.
All right, B, we have one more question before this last slide with the contact information. And I'll let you see if you can try to answer it or not, or get back to them at a later time. Oh, we have 2 more, I'm sorry. What are the required qualifications for the 10 to 15 staff?
Again, you can refer to page 6 to get qualification information. If you don't see what you're looking for there, please feel free to reach out to me directly.
And the last question is, the worker scope seems to be very extensive. Will the awarded organization seek subcontractors? How can I become a contractor with DFSS since I'm a sole proprietor? Question.
Again, I refer you back to the RFP. There will be agencies that fall in this, vendors, potential vendors, that fall in that category. And so I would encourage you, if you did not want to or you weren't able to find another vendor that you could subcontract with, you reach out to me.
All right, that's all the questions we have, B. So we're on the slide with your contact information.
Yes, I was going to ask you to pull that up. Thank you. You have my information there. For some people, use it, but make sure you put the RFQ number for this RFP, because the department has several other RFPs. But I prefer that you reach out to me directly. I'll also give you information for Nicole Kraft. If I'm in a position where I can't respond, Nicole will be able to. And then for all other questions, you have Julia's information there. And Julia is so gracious. She said she's available to you. I think I heard around the clock. And I'm not going to make that announcement. I prefer that you reach me via email, give me a call. But as she mentioned, I work Monday through Friday, 9 to 5. So if there are no other questions, Tom, then I want to definitely thank all of the potential respondents, and thank you for being on the webinar. We look forward to receiving your applications. Feel free to give us a call, drop us an email. We really want to work with you. So thank you very much.